Hello, I'm Sabrina Shaheen. I'm a cardiologist and I take pride in being a part of Women and Heart Disease program.
Hello, this is Uma Krishnan, and I'm also part of the Women and Heart Disease program. Heart disease initially was considered to be just a man's disease, but about 10-15 years ago, research has clearly shown that heart disease actually is the number one killer for both men and women. The American Heart Association decided to start a program, and this actually started about 10 years ago. It's called the Go Red for Women program, and it's symbolized by this red dress pin, helping women understand that they are at risk for heart disease. And it's also to help increase the awareness both for the patients and the providers to know that heart disease is the number one killer for women. But having said this, I also want to say that about 80 to 85% of the heart attacks can be prevented.
It's very important for women to identify the risk factors for heart disease, and particularly women postmenopausal. Once they hit menopause, there is that lack of protective factor and they get very prone to developing heart disease. Women who have hypertension are at increased risk of heart disease and stroke. Women who are overweight and obese, it's very important to focus on the BMI. High cholesterol, very important to control in prevention of heart disease. So the two most important things would be prevention of diabetes and adequate control of diabetes, because that has been shown to be a very important risk factor that leads to coronary artery disease. And smoking. It's very, very important to motivate our female patients, in fact all our patients, but particularly our female patients, to quit smoking.
I agree with Sabrina, where out of all those factors that you just said, I think diabetes puts women at a very high risk, at least 3 to 6 times higher risk for developing heart disease. In men, research shows it's about 2 to 4 times. And unfortunately, the other biggest controllable risk factor is going to be smoking. And women find it very hard when it comes to smoking cessation. So those two risk factors, if we can avoid or keep them under control, are going to be very important. Sabrina just elaborated on all the traditional risk factors, but right now we are finding out that women with connective tissue disease, and particularly inflammatory type disorders, do develop a lot of heart disease. And once we look at the new guidelines, I think it is listed in the guidelines just like screening women for diabetes. I usually ask, and I think you will be asking them specifically about rheumatoid arthritis or Sjogren's syndrome or lupus type symptoms, because that is considered a gender specific risk factor that can promote heart disease.
Exactly, I totally agree. It's actually inflammation that is created in the pre-existing plaque that leads to rupture and heart disease. And we have recognized more and more that all these connective tissue disorders are inflammatory disorders which can directly affect the vasculature and lead to heart disease. So that's very important.
The other thing that I usually ask my young patients when they come in, particularly as you said, like we usually see patients in their early 50s, I ask them about their pregnancy, because if women have developed either hypertension or diabetes during their pregnancy, we now know that they are prone for developing diabetes later on in life, and not only that, they are going to be more prone for developing heart disease. And I sometimes jokingly tell my patients that pregnancy is considered like a stress test done earlier in life.
That's very true. And it is an opportunity to identify the right patients at pretty early in their life and focus on prevention, so that the risk of developing diabetes in future is reduced and the risk of developing chronic hypertension is reduced if there are major lifestyle changes that are made right after the pregnancy, so the risk decreases subsequently.
I have to agree with that 100%, where prevention can go a long way, particularly when done earlier on in life.
There are some risk stratification tools which have been out there for a long period of time, like Framingham risk scoring, but the latest and the most up to date research has come up with something called 10-year ASCVD risk, and that is your 10-year risk of developing atherosclerotic vascular disease, which includes heart attack and also includes stroke. I think it's a very important and very effective tool because you can help identify people who are at risk of developing future events in the next 10 years. There's also a component of lifetime risk, which is not as well validated as a 10-year risk assessment, but it's handy and it's useful. Once you look at your risk in 10 years of developing heart disease, you get more aware and you're more ready to make those important changes which you've been thinking about but not able to. So I always encourage my patients to look at their 10-year risk factors, and whenever possible, especially when I see the patient for the first time, I kind of plug in their numbers and plug in their risk factors and have them look at their risk with their own eyes, because that definitely makes a difference.
I totally agree with what you just said. And once you show them, hey, we are going to do your calculation, we talk about their age, male versus female, and wants to know about their smoking status, whether they take medications for high blood pressure. And sometimes I play with it and I show them, hey, if you're a non-smoker, this is your risk versus when you're a smoker. And that is where I think it makes a huge difference. So based on the trend that I'm at least seeing is, I feel that my women patients definitely are willing to make lifestyle changes. Earlier, trying to get them to quit smoking was really hard. They would say like, hey doc, do you know, if I stop smoking, I'm going to gain 20 pounds. So now they understand that the risk of smoking is much higher than the weight gain, and they are really, really willing to do it. It's hard, but they are willing to do it. And then I personally feel that women do understand about the risk of stroke, particularly in the setting of high blood pressure, and they are very compliant with their medications, along with trying to follow a less than 2,400 milligram salt restriction to help control high blood pressure. So I personally feel through the awareness and through all the media and knowing that heart disease is the number one risk factor for women, I think I definitely see a trend where women are willing to be more focused on their heart health and be proactive.
I agree, and statistics have shown that there has been a reduction in heart disease and there has been a reduction in smoking in women, which just tells us how much more proactive women are. So I'm glad that we are going in the right direction, but there's a lot of work that needs to be done still.
I agree.